instance of Tzu illuminated the whole world. The Sun Mountain Dharma Assembly covers all over the world, over the sky. The gangster returned to the right path and dedicated himself to the Songcha performers. Taichung Fengshan Tzu Hospital is the most Jiang. It's great Buddhist jungle in urban area. Lots of activity are designed for young and old. Wisdom home essentially recruit neighborhood bodhisattvas. As a selling elder brother, Wu Jiade, he should become a valuable person in other people's hearts. We can praise, we could be a miracle. Our passion can drive the whole world. 高雄凤山集市堂 ，That's right, the most
这一个部分哈，其实是大家非常平常啊，也蛮去听到的。那以往他遇到的一个事情，个案里面就很多给很多的一个力量哈，所以这是我们台中慈院骨科主任蒋岳峰哈。
双脚瘫痪的主因是细菌感染。其实去年7月，王先生就感觉后背疼痛，还多次发烧到40几度，但查不出原因。没有想到细菌持续扩散，导致脊椎发炎。
不破坏肋骨的状况下，绕过这个脊椎的脊髓，然后绕到前面去，把这边感染的地方把它刮干净。
一般感染症状会慢慢加剧，但像王先生这样一夜瘫痪非常罕见。
脚的活动现在大概可以，脚趾头往上勾 ，OK。他脚踝现在也都脚踝还比较没有力气，慢慢都有在进步。对，在梦看这样。
目前治疗的方式
好，所以我们真的非常感恩大爱台，也为我们留下很多的见证，看到我们的医网是如此这样子的疼惜跟关照我们的病人。那么上人来到台中慈院的时候，当然要温馨座谈，所以呢就棒棒接力喽，把这所有的那在这个地方，我想让大家更去认识我们的慈济。台中慈服务
涵盖8个科别，病人不需奔波各个诊间，而是由医师找出病因，对症引荐。微创脊椎手术使用先进设备电脑导航，高龄患者术后康复，无需旁人协助独自行走。
There are 8 departments.
有如走秀，展示喜悦的步伐。
The minimum artificial surgery, we need the patients came back to hospital and to show her walking without any problems. The doctors help the patient to improve the patient's walking. We are very thankful for Master Zheng Yan provide us this kind of wonderful medical environment for patients. So the patients can have very good treatment in our hospital, Taichung Hospital. We are very touched and very thankful for doctors, not only doing his professional jobs in the hospital, they also came to do the show of sutra. Now we are introduced the doctor orthopedics, Dr. Jiang. We welcome Dr. Jiang to come to share his patient treatment. Dr. Jiang, we are going to see Dr. Jiang. Okay, here's the image of the Taichung Tzu orthopedics, Dr. Jiang. We are waiting for Dr. Jiang's sharing his patients' treatment. Now, Dr. Jiang is holding his cerebral moving in the hospital. Now he found a very nice place in the hospital to share his patient treatment with us from Taichung Hospital. Now Dr. Jiang is going to introduce the full artificial hip joint replacement upgrade version. Now we are going to introduce an anterior approach of the hip joint replacement operation. Good morning, all the family members. Today is the online study. So I'm going to introduce you all the family members of the artificial heat replacement operation. Now, here is the upgrade version of the operation. There is a posterior and anterior approach of this hip replacement operation. Now, I started to work for Taichung Hospital from 2010. There are 75 years old patients, and we can get the story from online because there's a press release. There's a very big abscess in patient's leg. And we can see this 72 years male patient has been drinking for 30 years. So he has got a very big abscess in his hip joints. So we can see a very big crown from the patient's X-ray. It's because this patient has been drinking for 30 years. That's the reason cause patients leg. Now we are going to introduce this anterior, the minimal invasive hip replacement surgery. This is the traditional posterior approach operation diagram. So the doctor, we need to cut off some leg muscles. We cut off the muscle to dislocate the joint. After the dislocation, there's a joint after the joint dislocation, we just put into the bone head. Then we implant the hip replacement joint after the whole set of operation. So there are two different kinds of hip replacement surgery: anterior and the posterior. Posterior approach is from the back of the box, and the main complication is the artificial hip replacement dislocation. The main complication of this operation is the hip joint dislocation. So there are many post-operation precautions. The posture of how to sit, how to sleep. The patients need to be very careful about his posture to just reduce the pain of the operation, reduce the blood loss, and reduce the possibility of blood transfusion, and also can reduce the date of hospitalization. It also can reduce the family burden. There, the operation is very difficult. The view of doctor is very limited. And conclusion of this, the artificial hip replacement is very safe. And this is a very, the traditional cut is 16 centimeter, but the minimal invasive cut is very, very small. If we believe in the books, better than no books, the target of the operation, we need to complete the operation. In the process of the operation, there are only 2 very small wounds. We need to have very minimal damage in the process of operation. We can do the very invasive surgery. We just need 2 axes and combine 2 axes of the bones. And we can also make use of the mobility of the soft tissue like skin and other soft tissues. So it helps our operation. And we can just rotate this kind of soft tissues. Then we can see everything in just very small wound. The minimal invasive operation. Now we are going to see the detail of this minimal invasive operation. Patients is very satisfied with my operations. Now we photo pictures of patients' process for record. And we also share this kind of treatment case in the also pedics meetings. I'm going just to briefly introduce the materials and the method of my operations. It's very professional data chart. The yellow color columns, the full artificial heat replacement. The green color is the semi very young patients can be discharged after six days of hospitalization. This is another chart of single surgeon experience. Artificial and the semi artificial hip replacement. The operation is for about an hour. The wound is very beautiful, and the day of hospitalization is very less, very short. This is the research conclusions.
So due with a period dislocation in the hip joints. So from comparing the transitional operation and the minimum invasive surgery, that the incision cut often is so much smaller and it is easier to heal. And it will reduce the dislocate of the hip joints. And we also encounter difficulties. And there's a patient who is 85 years old who after the surgery, she had 3 times dislocation in the hip joints. And there's a patient who's 90 years old who also encountered hip joint dislocation. So we hope that we are looking for the better solution for that our patient will not encounter the hip joint dislocation. And we keep looking for solution. For example, like Richard Berger and Bertin Rotinger. We try Richard Berger. We encounter complications, too many complications. And Bertin Rotinger method, it's very difficult to conduct. And so I was not satisfied with the result of the Rotinger surgery. And then I have surgery for counter surgery for one of my patients who is over 80 years old, and her brother came back there to visit her. Her brother was an internal medicine doctor in the US, and he asked me why I didn't want to use DAA, the direct anterior approach. And are you not satisfied with the DAA approach? And right now he said right now in the US, most doctors adopt DAA approach more and more. And so the American doctor and gave me this suggestion, why don't I use the direct anterior approach? So I got online to do the approach. And this was what I found out from the internet, that the directive anterior approach has successful rate is so much higher than the anterior approach and the lateral approach. So the direct anterior approach is so much better, so much more successful than the posterior and the lateral approach. And also include a minimum invasive hip arthroplasty is so much better if we include if we use the minimum invasive approach. So we could combine 2 axes of rasping and reaming for the acetabular joint, so we could minimize the incision. and we are looking for the solution. So we want to advance our skill. We have to study. So we study very hard and discuss with other doctors, like for example, from the veteran hospital from Taipei, Yang Sitie doctor, and the hospital in Shuanghe, Wu Lianzhen doctor. I went to the Taipei Veteran Hospital. I went there in year 2020, in March of year 2020. It was the during the severe outbreak of the pandemic, but I still went ahead to go to the Taipei Veteran Hospital to learn the new skill. And the left was an anterior. The left was the anterior approach, using the anterior approach. And this is a very successful. Although it was my first case, but it was very successful. And the learning curve was very frustrated for a beginner because we encountered complications. The first case was successful, and later 3 patients they have other difficulties, complications, because our skill was not mature enough. For example, like the top of the greater tubercle was a femur was broken by the expander, and also they suffer from the malaria, paresthesia, and also they lost a lot of blood. And so we want to how do we move on? We study harder and harder and learn from other more experienced doctor. And so we hope that we could approach to the soft tissue to alter to maybe position the patients that would position their soft tissue so that we could reduce the damage created while we conduct the operation. The last year, we have already have 28 successful cases. So the loss of blood was minimized. And so there's another complication is the fracture of the stem of the femur bone on the side of the femur bone. And this the last year in the orthopedic annual meetings, we reported that this is the fracture in the stem of the femur bone. So we cut open because we didn't see it very clearly. So we cut open the place we cut open was too low. So we cut open the greater in the middle of the greater trochanters. So we introduced the fracture in the greater trochanters. That until the end of the last year, we have already operated on 28 patients. And so we are improving our accumulate our experience. And so we know that right now there are still very few doctors who are able to conduct this DAA, direct anterior approach surgery for the hip replacement. Every 5, we will compare. We do the comparison every 5 patients. For the total hip replacement, the average age was about 61 to 60.8. For the semi replacement was around 78 to 83 years old. And after our skill was improving and advanced, and so the total hip rejoint, hip replacement, total hospitalized days was from 4 days to 4.9 days. And if they do a semi replacement and the hip joint, it was the total hospital stay was from 6.2 to 8.6 days. And also the duration of the operation also minimize and the loss of the blood during the operation, and the total replacement was about 288 milliliter, and the dose of the blood for the semi was 118 millimeter. And the incision one was the length of the incision for the total replacement was from 8.8 centimeter to 10.2 centimeter. And from the direct anterior, we could reduce the duration of the operation to within 1 hour. It's about 45 minutes. And also we could, the loss of the blood amount was reduced. It was used to like 350 milliliter, and now it's probably around 180 to 250 milliliter. And also, we could, if we do the operation from the posterior, we use a posterior approach. We have to cut open the gluteus maximus and a lot of extensor muscles, so it would affect the heat patterns. So the patient would have a lot of time. Quite often they have difficulties in walking smoothly. Now, we encounter technical difficulties. We cannot hear anything further from Dr. Jiang. And maybe there's an internet technical glitch. Dr. Jiang, maybe he is still continuously talking, but we cannot hear him. And now it's a freeze on the screen. Maybe there's a constraint in the bandwidth. And you can see that from his sharing, from doctor's sharing, they really recorded down the patient's conditions, and they are you can see that they are so mindful to record it down all the cases. And Dr. Jiang gave us share his experience through through his experience, he could compare before and after the surgery, and so that he would have the reference for in the areas where he could have more improvement in his own skill. And Dr. Jiang, he's already an expert the expert in the orthopedic field, but he still very diligently learning new skill because he wants his reduce the complications from his patients after the surgery. And I want to, although I don't understand on his report, but I still feel very touched by his report because it's so much detail listed in his report. He recorded a lot of detail because he want to know the patient's condition better so that he would understand better how the condition goes, and so he knows where he could improve his own skill. And his experience is so valuable that he could, from his experience, the doctor, when the doctor, oh, I'm sorry. Oh, there was interruption in our connection. And could we continue? And that's welcome you to come back.
我们掌声回来，然后就是欢迎你再度回线哈。那刚才我到底讲了些什么？请看回播。我刚有好，不过好。
像这是第50位病人。他的现身说法就是说
比较严重了，比较深层的地方在深层在缝的地方是在麻。你刚刚
不是，那个主任，你麻烦你要讲到，你要打开你的简报。
I cannot see the Dr. Jiang from my screen, and I don't see his PowerPoint presentation.
影像也没出现，然后简报也没出现。是。
And now we are waiting for the Dr. Jiang.
好，那我们等主任一下哈。
现在有了吗
？And Dr. Jiang, can you show up yourself on the screen? Can you use the full screen?
然后，对。
Oh, finally, we see your face.
没有，你看它还是断的状态。好，现在人是出现了啊，人回来就是基本上就是一件好事。但是现在
Let's welcome
我们发现你
Dr. Jiang come back.
OK， 然后掌声感恩主任来。接下来就是你要从这个地方开始分享，对不对？我们
this is where we were talking about. And this is the patient was sharing. And she received the DAA surgery approach. And how do you feel? And she had the posterior approach surgery and the anterior approach surgery both way, and she felt that the direct anterior approach is so much better. She say she feel when she stepped forward. When she used after the posterior approach, when she stepped forward, she felt very tight in her hip muscle. While using the anterior approach, when she walked, she didn't feel the tightness in the hip muscle. So this for the past 20 years, I have a 20 years experience in the surgical approach at hip joint replacement, but I'm still continue learning the new approach, and now we adopt the DAA direct anterior approach, and about 40 to 50% successful rate. And we are continuing accumulating every experience, and my skill is advancing over times. And we still have we encounter difficulties, but we have to for some severe cases we have to take good care of them after the surgery. Dr. John has was disconnected, and there was a very great PowerPoint presentation. And thank you. And you can take a look at the PowerPoint presentation that I'm showing. Dr. John was sharing, but he was disconnected. And in the very last pass, and let's listen to it. And in the depth hip joint, I feel just stingy, and I feel numbness in front of my thigh, and I feel stingy in the hip joints. And so this patient, he felt the numbness. So there's a damage in Dr. John. I have to conclude your sharing. And these were sharing. These were the sharing that was disconnected. So there's the PowerPoint presentation. He gave us very complete information, thanks to Dr. John. And today, very early morning, I have done. I talked to the superintendent. I told the superintendent that Dr. Chen is going to share with us on the online study group. And the superintendent say Dr. Chen is a very skillful, a very experienced, a great doctor. And thank you for your sharing. And it's such a pity that you cannot come here today because you have other patients to take care. And so next time, I hope that you could come to Kaohsiung online study group. And the feedback from Canada, Guanxining, and I see a lot of my friends and families are suffering from the hip joint pain, and we hope that we could go back to Taiwan to visit Dr. John to ask him to help. And also we also need to expose ourselves in the sunshine so that we don't have the bone density loss. We could keep ourselves healthy. And study is very important. Thank you for the doctors. Thank you for your patience, and your mindfulness in taking care of your patients. And thank you, Dr. Jiang from Taichung City Hospital. Thank you. Although there's interruption in the sharing, but thank you. You gave us a great sharing. Thank you. And thank you. And we are next. And we are going to Yunnan, say from Yunnan, and say Suman, Sister Suman sharing was very